Good afternoon, viewers. Welcome back to our podcast. Uh, you've been sending me a lot of questions. I've had a lot of questions and inquiries regarding our treatment program, how it goes, and what it entails. So today, I'm very honored to introduce our doctor, our lead psychologist, Dr. Ken Ochieng, who also doubles up as our manager. He'll be telling us more about the treatment program, how it goes from the time the client is admitted to our rehab up to the time when they are discharged, and also briefly about the follow up program. Stay tuned and welcome, Dr. Ken.
Yeah, thank you, Isaac,
Thank
for this privilege
yeah.
and this opportunity.
Mhm.
Yes, briefly, we want to discuss about the program.
Yeah.
And when we're discussing about the program, we're discussing majorly about the inpatient program.
Yes.
So, first and foremost, I want to say that the inpatient program is tailor made for individual needs because not all the patients or the clients that come for the inpatient have the same nature of needs. And the program runs in different classifications. One, we have a 6 week program, and I will be able to mention what type of people who the 6 week program focus on. We also have an 8 week program. We also have a 12 weeks program, and also we have a program that can run up to 6 months.
Okay.
When you're talking about the program, we are talking about the phases which the treatment takes in order for the person who is in need, in this context, our client, to be able to get the necessary help that they need.
Mhm.
And the first thing also is to understand that we have three types of clientele or three types of patients. One, we have patients who may be suffering from what we call mild addiction. So there are people who, when it comes to addiction, they are not yet at the stage of severe addiction. They have just begun. Maybe it is experimenting. These are people that it has not really taken a heavy toll on them. And sometimes these are people that are even students, people that are still, in campus, or people that sometimes are in high schools, yet they've started doing drugs, or alcohol is taking a toll on them. So these are people that sometimes can just go for a short period of program, which is 6 weeks. That entails a 2 week detox and a 1 month intense program of psychotherapy.
Okay.
We have another slot of people, like I said, who may need an 8 week program. These are people that sometimes they are really not that heavy into addiction, but also we have what we call dual diagnosis. These are people that sometimes you find that they have psychiatric problems. So somebody may have had an episode, let's say an episode of mania, an episode of schizophrenia, an episode of psychosis. It's a brief psychosis. So it can be stabilized with the right medications and the right therapy within that short time frame. And then now we have people that sometimes go through the entire program, which, like I've said, now is 3 months and past 3 months. These are often people that experience what we call severe depression. So these are people that, one, they lack insight, they are in serious denial, their life is highly dysfunctional, their health is at risk. So these are people that need to go through an entire program that is a minimum of 90 days, which can be more. So that those are the classes and those are the time frames. So when a person checks in a program, the first thing that we do is the person has to go through what we call screening and assessment.
Okay.
So the person will be screened. We have different tests, what we call toxicology, if the people are the ones who are using drugs. Then we have a different set of assessments. We have blood work and all that. And then people also go through detoxification, because there are people, especially ones who are using drugs, some of them experience what we call withdrawal syndrome.
Yeah.
So, in a period of a minimum of 5 days, which can run up to 14 days, during that setting, we help them medically to detoxify.
Okay.
Then from there now, they are induced in what we call orientation.
Okay.
So the part of orientation, which runs at least for 2 weeks or it can go to 3 weeks, is more of what we call building insight. Because not everybody that enters into the treatment comes voluntarily.
Yeah.
There are some who are brought in voluntarily. So they need time to be able, to settle down, to understand, and also to let go of any emotional uh, feelings that are negative, uh, because of the approach that perhaps was used.
Yeah.
So we call it an induction process, where we assess the immediate needs of a client or a patient, and they are able to be helped. It's more of what we call first aid in psychology.
Mm-hmm.
Once they are settled and they're grounded and now they understand why they are here, then now we proceed now with the underlying issues
Yeah.
of, the client or the patient, because there are things which are more presenting. We don't just go with the symptoms of what we are seeing. There are underlying issues. So during this phase, there are different types of therapies that take place. We have things like individual therapies, which there are many techniques to go about it. And this one helps the person to be self aware, to be able to confront the issues that are undermining their health and their addiction. And then we have things like family therapies that are also in between, where we are able to look at the contribution of the family, be it your father, be it your mother, be it your husband, be it your wife, be it your brother, your sister, that at the end of the day have played a key role into your addiction. Because in family therapy, there are families that are enablers, they are precipitate or they fuel the disease. There are families which are the triggers, and then there are families which are the supporters. So when a person is coming to the treatment, we have this saying: the person who is addicted or the person who is suffering from the mental illness is infected, but the people surrounding that person are affected. So they also need, to be part of the treatment.
Yeah.
Them being part of the treatment helps them with number one, becoming aware and understanding the nature of the disease or the nature of the problem. Because many people assume they know, but they don't. Secondly, it is also to equip them with skills that can help them manage their patient or their client post rehab. Thirdly, is also for them to be able to know and identify patterns which they play to bring what about we call codependency. So once we finish with the family therapies, then we do what we call occupational therapy. So the occupational therapy tends to focus more on helping and building the person, the client in this regard, or the patient, to be able to have skills that can help them to run their day-to-day life, especially in the line of productivity. So if it is a student, can they go back to school and they study and finish their course? If it was somebody who was working, can they be reintegrated back to work? If it is somebody who wants to start a business, can they be equipped with financial skills, entrepreneurial skills to help them start a business? So we will call it occupational therapy. So once we are able to achieve that satisfactorily, uh, then now the person is, discharged.
Okay.
So once now you are discharged, depending on the prognosis, we have now what we call a follow-up that can run from 2 months to even a year.
Mm.
So this is dependent on the prognosis. So there are people who now, when it comes to follow up, they can be coming twice a week or they can be coming once a week. And once we continue with the follow up one is to be able to gauge and see if their insight, their judgment, their triggers. They are able to identify such kind of things in order to strengthen them. Also, during the follow ups, we are able to plug them in things like alcoholic anonymous groups or narcotic anonymous groups. It can be a church. So, any community that can help them into growing,
Yeah.
into becoming fully functional, into becoming productive, that is part of follow up. So, basically, that is when we talk about the program, that is how the program flows.
Okay.
Yes.
Mm.
Thank you, Isaac.
Yes, thanks a lot, Daktari. You've really explained the real issue that
Yes.
people have been asking. And there's something also I wanted to ask. Someone asked me,
Mhm.
is this program, is it spiritual?
Yeah, it is important. And here it is good that our viewers understand
Yeah.
the program is spiritual, not religious.
Okay.
Yeah, because many people cannot distinguish between religion
Mm.
and spirituality.
Yeah.
So when we are talking about religion, these are, people's faiths or beliefs. You can find a person who is a Christian.
Mm.
Within the Christian community, we have very many sects,
Yeah.
of the same faith, very many sects. There are people who don't believe in religion.
Mm.
They believe in science and the totality of the universe. There are people who are from other religions, Islam and many more others.
Yeah.
So when we say the program is spiritual, what we mean is this program, we believe in a power that is higher than us.
Mm.
You may want to call it whatever name you want to call it, but it's a deity. We have to understand that in order for us to be able to fully recover, then we have to tap into the dynamics of spirituality.
Mm.
Why? Because when we are dealing with mental health
Mm.
and when we are dealing with matters addiction, we have to understand that this nature or the dynamic of this disease affects not only the body of a person,
Yeah.
okay? Because there are people which it affects the body. Organic diseases affect the body.
Mm.
But when we're talking about mental illness and when we're talking about matters of addiction, we are talking of a disease that penetrates not only in the body but goes even to the soul of a person. When we're talking about soul, we're talking about the mind, the will, and the emotions. Once you get into that sphere where you're dealing with the mind of a person,
Mm.
you are dealing with the will of a person, you're dealing with the emotions of a person, then already you have crossed over to what we consider spiritual.
Yes.
And there are references which we use in terms of spirituality in order to help people heal.
Mm.
Because once we are talking about spiritual, like I said, human beings we are tripartite. We have the body, the soul, and the spirit.
Yeah.
So yes, there are things we deal with the spirit of an individual, but also there is a way for the program to be holistic. It also has to heal the soul of a person, and also now the framework of the body, where the medication and everything also has its own part. So when we say the program is spiritual, it means that the program is not only addressing the deficiencies or the defects in the body, it goes beyond the body. It
Yeah.
touches the soul of the person, it touches the spirit of the person. That is what makes it spiritual.
Okay.
Yes.
Yes, thank you, Daktari. I have two more questions that
Yes.
have been very persistent.
Mm.
One, there are people who have been asking me,
Mm-hmm.
how do you admit people involuntary? How do you go about it? Because there are a lot of people who have friends and
Mm-hmm.
relatives who are seriously sick and seriously suffering
Mm-hmm.
from alcoholism and drug addiction, but they don't know how to get them into the rehab because these people have refused to be helped. they've refused to be rehabilitated. So the families, they don't know how to go about it. So what can you advise?
Thank you for that question, Isaac. This is the dilemma that many families have because families are caught at crossroads. One, there is this narrative that usually is pushed that if you want to help this, population, then they have to be willing. They have to be they have to volunteer to check themselves into a rehab facility, even though that narrative is inaccurate. Reason being, people, there are people who understand themselves. They know they have a problem. They have self-awareness. They have a problem. They need help. Those ones have no problem. They check themselves in a facility. When they get the right support, they take it. But there is this population which is sick. Addiction is a mental sickness. It is not a moral decadence problem alone. Because many people, and this is one of the things we have to demystify. When we come and find somebody who is suffering from alcohol use disorder or substance use disorder, or even mental illness, things like bipolar schizophrenia and etc.
Yeah.
So many people don't understand that these people are sick. So when somebody is sick, like I have just mentioned, their mind is also affected.
True.
So they tend to develop poor judgment. They don't have insight. And for them, they are okay. Even though this person's health is deteriorating. Now, you cannot advise that person into treatment. You cannot love that person into treatment. You have to take action. And that action means you have to take that person by force, perhaps sometimes into the treatment. And now, how do you do that? We have to work with the law. So we are not harming the patient, but the patient does not have the requisite level of understanding and judgment to be able to know that I am okay or not. And the more you delay on that, hoping and wishing that one day they will come to their senses, they will not. It will only worsen. So you who is sane must take action. And how do you do that? We have two ways to go about it. Number one, there is the use of law, where you can alliance with police officers. You tell them, my child, my husband, my wife has this problem and they need help. So I need you to escort this person to the treatment facility. Why the use of law? Because these people tend most of the time to be very aggressive. So when you come and take them and they are very aggressive, it may escalate and it may bring more harm. So you need people that are well trained in order to help with that process. Secondly, if you don't want to use the law, you can use what we call the recovery team of treatment. Rehabs, in this case, our rehab, we have a recovery, what we call the intervention team. These are people that are well trained in terms of security, in terms of their well-being, so they know how to excavate the person without inflicting harm on the person, and they can be ferried to the place of treatment and they can receive the treatment. So that is how you can go about it.
Okay.
Yes.
Yeah, thanks a lot for that. And viewers, I hope we've answered that question. Many people have really asked that question. The other question is the importance. What's the importance of family therapy during the treatment program?
The importance of family therapy. I said the person who is suffering is infected.
Yes, yes.
The people surrounding the infected person are affected.
Yeah.
This thing that we are discussing, addiction and mental illness, it is not a new phenomenon in the medical world, even though, especially, and let me be very specific into our country,
Yeah.
it's a pandemic that is slowly growing. And truth be told, not many people are fully aware or have understanding on the manifestations, the causes, and the effects of this thing called addiction. So by the time the family comes to understand, there is a lot of emotional, financial, social, and even physical damage that has been done.
Yeah.
You understand that?
Yes.
Let's say you have a person who is an alcoholic, or a person who is using drugs, or a person who is mentally sick. This person, you will tend to think they are doing this because they are morally, not right.
Yeah.
They are morally upside down. So these people, or the nature of this disease is that it brings pain. These people will bring havoc or mayhem. Sometimes they will sell things of the house. Some of them will be violent. There will be cases of violence in the home, in the family. There will be cases, of emotional issue. These people have said things they're not supposed to say. They have done things they're not supposed to say. Sometimes you will incur legal problems. You'll find yourself in very serious legal issues. You understand? So the damage which is happening is not just happening to them as individual. It is spilling to the family. So it is also important for the family to heal.
Yes.
It is important for the family to understand what is going on. We are all victims of this thing. It is important for the family not only just to support the patient or the client, but it is also an opportunity for them to have therapy, that as this person is healing, we are also healing.
True.
That's the importance of family therapy. That's why I say, yes, the first thing is about insight and self awareness. This is our problem. This is what we are dealing with. These are the causes of this thing. These are the manifestations of this kind of disease. And these are the solutions. That is insight. But also, the codependency have been hurt.
Yes.
If it is husband and wife, there are issues of infidelity that sometimes will arise. If it is, parents with their children, sometimes there are issues of lies. And parents have spent a lot of money, sometimes even in school. Children have dropped out of campus. It hurts.
Yeah, it hurts.
There are issues, like I've said, of legal problems. People are chasing cases. You did something while you are drunk. Now, all these kind of things, there are financial losses, financial damages. There are issues where sometimes loved ones attack each other physically.
True.
Issues of domestic violence.
Yeah.
So it is important that, as the person, yes, you're looking for help for the person to heal. You also have wounds that also needs to be healed.
True.
So that is the importance of family therapy.
Okay. Yes. Yeah. Thanks a lot, Daktari. You've really opened us up, and I'm sure viewers, we've answered most of your questions, and tune in. We'll be talking more with Daktari as we go on. He has a lot to share with us. As I said, he's our lead psychologist and also doubles up as our manager. And he's a great doctor. He's a
Thank
great
you.
doctor.
Thank you, Isaac.
He's doing a great job. Together, we are helping a lot of people. And kindly, we have been saying, there is hope. If you have a relative, you have a friend, you have a spouse, you have a child who is suffering from addiction, please don't try to help them on your own. On your own, you can't. We have professionals who are doing the job. If you don't have a way on how to get them to rehab, call us, contact us, and we will be able to help you and to advise you on the best way forward. As we are always saying, our slogan is there is hope, and no one is too far gone. No one is beyond help. There is a solution to that issue. So keep on making the inquiries, keep on calling, and keep in touch, and also subscribe to our channel. Thanks a lot for your time, Daktari.
Thank
We
you.
appreciate.
Thank you.
Thank you.